hierarchy of evidence.
So we can get a sense from the studies that we've discussed that there's a hierarchy in evidence, a hierarchy in believing that the association between the exposure and the outcome is likely to be true. We can see that a randomized control trial might be more believable than a cohort study, and a cohort study would be above a case control study. Above a randomized control trial would be a systematic review of randomized control trials. Below a case control study would be a cross-sectional study when the exposure and the outcome are measured at the same time. This is called an analytical cross-sectional study. Below that come other study designs like ecological studies where data is collected at a population level, not an individual level. And then below that would be case series and case reports, which are really just anecdotes in terms of believing an association. And then below that again is opinion. So that means that evidence-based medicine, decisions based solely upon authority, it really isn't what we're looking for in modern healthcare. We will also hear about the grade system and other ways in which we can classify the strength of the evidence for a recommendation about a treatment or a diagnostic test or a risk factor. That's a structured way to rate the certainty of evidence and the strength of our recommendations. Even randomized control trials can be rated down if they are biased or if they're imprecise, and observational studies can be rated up if their results are very compelling. All our clinical guidelines will have a nod to grading evidence.